Abnormal Psychology BA 6th semester session 39. The topic is causes of autism. Causes of autism. The precise cause or causes of autism are unknown. Although most investigators agree that a fundamental disturbance of central nervous system is involved, many investigators believe that autism begins with, say, some type of inborn defect that impair our infant perceptual cognitive functioning, the ability to process incoming stimuli and relate to the world. Before discussing the evidence, we first briefly consider and reject environmental explanations, psychological and social. For many years, parents were blamed for causing autism in their children. Psychoanalytical speculation said autism result in infant defense against maternal health. Recent MRI research suggests that abnormalities in the brain anatomy may contribute the brain metabolic differences and behavioral phenotype in autism. Whatever the physiological mechanism or brain structure involved, evidence has accumulated that defective genes are damaged from retardation. Other conditions during prenatal development may play a significant role in pathological picture. Biological factor despite in the severity of the disorder and its unique symptoms. Autism does not appear to be a disorder. Instead, current thinking is that, like intellectual disability, autistic spectrum disorder includes several problems that look similar but actually have different biological causes, known causes of different autism, as included Fragile X syndrome, related disorder, and a handful of others known causes of intellectual disability. Evidence for a genetic contribution of autism comes from examining the risk for autism in the sibling of autistic. The best estimate are that an example families with one child with autism, there is a 3 to 5% risk of a sibling having autism as well, although this figure may seem too low in an absolute sense. It is in fact extremely high given the frequency of autism in the population. The most extensive autism genetic a research project that recently reported that any rare variations in genes increases the risk of autism spectrum disorder. These results suggest components of the brain movement neurotransmitter system are involved in autism. This autism seemingly results from faulty wiring in the early stages of development, that is, a glutamate increases neuronal activity and plays an important role in wiring the brain during early development. The exact mode of genetic transmission is not yet understood, but it seems to likely that relatively may also show increased risk for other cognitive and social deficiency that are milder in form of true autism. uh, just on schizophrenia, there may be spectrum or disorder related to autism. The prevalence of autism as much as 100 times greater among siblings of a child with the autism that several studies found higher prevalent among the MZ and the DZ twins in the largest study to date. The 160% of monozyte twins or 0% of the decussite for a broader spectrum of determine the rate of 92% and MZ and 10% in DZ twins same study. Psychological factors that play a role in autistic disorder included attention deficit. Autistic children fail to attend to social stimuli such as their mother face and voice or others calling their names. Perhaps the most intriguing finding of all that autistic children have deficit in the theory of mind. Treatment and the outcomes of autism. The treatment prognosis for autistic disorder is poor, and because of the severity of their problem, those diagnosed with autism are often insufficiently treated because of the typically poor response to treatment. Children with autism are often subjected to range fads and novel approaches to turn to be equally effective. Medical treatment. In the past, the use of medications to treat children autism has not proved effective. The drug most often used in the treatment of autism are antidepressant and antipsychotic medications, but the data and their effectiveness do not support their use unless a child behavior is unmanageable by other means. If irritability and aggressiveness are present, the medical management of a case might involve the use of medications to lower the level of aggressions. Although there are no surefire medication approved for this purpose. The next one is behavioral treatment. Like behavioral therapy is on institutional setting has been used successfully in the elimination of self-injurious behaviors, the mastery of the fundamental of social behavior, and the development of some languages skills. In behavioral treatment of children with autism is reported highly positive result from a long-term experimental treatment program. The intervention developed by the Lovers and colleagues is very intensive and usually conducted in the children's home rather than a clinical setting. The children are usually immersed in a one-to-one teaching situation for most their waking hours, overall several days. The intervention based on both discrimination training strategies and contingent aversive techniques. The treatment plan typically enlists a parent in the process and emphasizes teaching children to learn from the interact with the normal peers in real world situations. Other treated children in a study by Lois and colleagues, 47% achieved normal intellectual functioning and another 40% attained the mildly retarded level. In comparison, only 2% of the untreated control children achieved normal functioning and 45% attained mildly retarded functioning. This remarkably resulted, however, required a considerable staffing effort with a well-qualified therapist working with each child at least 40 hours per week. So the world of the autistic the impact that the having child with the autism can have on the family, both parent and sibling, and describe the ways dealing with the problems that can arise, including the possible need psychological treatment for other family members. So the behavioral therapy is a very effective treatment, and the effectiveness of treatment is a evaluate the long-term effectiveness. The never treatment methods of degree improvement they actually accomplish also reports the effective behavioral intervention. In some areas such as attention skills have been noted the prognosis of children with autism, particularly the children showing the symptoms before the age of 2 years, is poor. Commonly, the long term results of autism treatment have been unfavorable. A great deal of attention has thus been given to high functioning children with autism. So, one important factor limiting treatment success is a difficulty that children with autism have in generating behavior outside the treatment context. Children with severe developmental disability do not transfer skill across stimulations very well. Consequently, learning behavior in one situation does not appear to help them to meet challenges. So, behavioral therapy is very important, playing very important role for treatment. So, autistic spectrum disorder is a pervasive developmental disorder according to DSM-4 is involves disturbance, relationship, stereotype activities, communication. This can range from relatively mild severity. Autism is the most wide research is the autistic spectrum disorder is extreme symptoms including intellectual disability. As per this disorder often referred to autistic spectrum disorder was first described Hans Asperger in the year of 1944. Many of the behaviors found in this disorder A similar of those found in autism, the pattern of the behavior usually appears later than other pervasive developmental disorder such as autism. So, but is nevertheless involves substantially long-term psychological disability. Asperger's disorder shares many features of social impairment disorder, restricted interest, and repetitive behavior with autistic disorder, but it may become the manifest somewhat later than autism, and in most cases is not associated with the severe delay in language development and social interaction that autism, the pervasive as rates is per thousand rate 2.5 according to the DSM-4. The behavior associated with the Asperger disorder is often viewed by lay persons as odd and centric, including nonverbal learning disability, striving to maintain sameness and physical awareness, problem with languages, and social skills and emotional instability. According to DSM-4, the essential features of Asperger's disorder involve both severe and sustained impairment of interpersonal interaction, including impairments of facial expression, body posture, and gestures, and people with the Asperger's fail to develop peer relationship. Interestingly, in contrast to autism, in Asperger's disorder, there are usually no clinically significant delay in early languages or age appropriate self help skills. However, several research have described the high rate of suicide during adolescence among persons with the Asperger disorder. The patient with the Asperger disorder are often treated with the psychotropic medication, including antidepressant, antipsychotic, and mood stabilizers such as Latimate. A number of behavioral treatment approaches to improve the functioning Asperger patients have also been used. Several known causes of intellectual disability may also cause autistic spectrum disorder, which appears to be caused by multiple, mostly unidentified biological problem. Applied behavior is also analysis is a promising treatment for autism, but expensive and effort involved are considerable. These are the reference book I have collected the information. Hannah M. Greenish, Johnson, Davison, and John and Neil in the year of 2012 abnormal psychology, and Butcher, Woody, and Susan in the abnormal psychology in the year of 2014, and Susan Nolan and the Oaksman in the year of 2011 the abnormal psychology 5th edition, and James Hansel and Lisa Demont 2008 and abnormal psychology that is second editions.